Thank you, Mr. Chairman. Dr. Berwick, thank you very much for being here and for all your testimony. I wouldn't be surprised if anyone watching this is somewhat confused. A lot of consumers aren't quite sure they are beginning to reap the benefits of, as my colleague Ms. Neal pointed out, that no longer can an insurance company discriminate against them because of a pre-existing condition. All of a sudden they're finding that their recent graduate child from some college who can't yet find a job is still able to stay on the health insurance coverage of that parent. So they're beginning to see the benefits, but I don't doubt that some of them are confused because they hear all these anecdotal stories, or they hear about these projections, or they hear about these scare tactics, death panels, and all the rest. But I think you started off your testimony by saying where we're being told that seniors should be very scared when it comes to HMO Medicare, that they're going to lose their insurance coverage, that it's just the opposite. Can you repeat what the actual numbers show, not the projections or the speculation is?
The projections were of a decrease in enrollment in Medicare Advantage this year. We're seeing a 6% increase in enrollment. There are now 26, on average, 26 Medicare Advantage plans available in every county in this country on the average. We've made those choices more meaningful. A lot of the Me Too plans, the nonsense that was there where there wasn't really any difference, they're gone now. And when a beneficiary looks at their options, they're meaningful options. They can scan down the list of Medicare Advantages to pick out and say, that's the one I want. That's the one that meets my needs. Meaningful choices being exercised and lower cost.
And I was about to go there. The other scare tactic is seniors in America, be afraid because your costs are going to rise. And those are the scare tactics and the projections. What's the actual result on paper?
On average, the Medicare Advantage premiums are down 6% this year. Now, that's not for every single person. Some people will choose a Medicare Advantage plans where the premium goes up because they have a different benefit structure that they prefer. But the average premium went down this year, not up.
And let me make sure I understand this. Some 3 million beneficiaries under Medicare, close to 3 million seniors, got a $250 tax check to help them pay for their prescription drugs if they fell into this.
Over 3 million if they fell in the donut hole in 2010. This year, if they're in the donut hole, they'll see a 50% reduction in the prices and the cost they're paying for many brand name drugs.
Well, hopefully we'll be able to continue to have you come and others testify about what actually is in the bill, not what might be or is projected to be in the bill. The other thing I wanted to get into, let me make sure I understand this. You are within the federal government, as I am, as every one of my colleagues is.
Yes.
So you qualify for the Federal Employee Health Benefit Program for your health care.
I do.
And everything that I understand from the bill, and having helped push that through and get it enacted, and knowing how we're going to try to reduce the cost, one of the things we try to do is give people choices. And as you and I and every one of my colleagues has a choice of plans through the Federal Health Employee Benefit Plan, this new law, historic new law, will give a lot of Americans a choice in what plan they decide to select. Is that correct?
Many choices, more meaningful choices.
And just as members of Congress and you and other members of the federal government receive government support, public support, to help pay for the cost of your health care plan, of each and our health care plan, so under this new historic law will Americans get some support, public support, some would say government support, for the cost of, or the paying of those health care plans.
That's correct.
Now, some would say that's a government takeover, and I think I did a quick survey. I think that plan, which is now law as a result of the historic passage of health care reform last year, which now gives Americans those same choices through these options, this marketplace and exchange of options that will be available, and with some federal subsidies, taxpayer subsidized assistance, is very similar to what we get, each and every one of the members of this committee get for health care as well. In fact, my recollection is the subsidy that members of Congress, Republican and Democrat, get for their health care under the Federal Employee Health Care Benefit Plan is actually greater than the taxpayer support that will be provided in subsidies for the new law. Is that correct?
I believe so.
So every time we hear folks talk about government takeover of health care, it's interesting. It's not good enough for the American consumer, but it's okay for members of Congress to continue to get government-sponsored health care, and it's okay to have the choices there, but to give that to the American people seems like we're not quite hearing the full story. So I hope we'll have a chance to hear you more often and talk to us more about the implementation of the legislation. And I thank you for your testimony.
Thank you, Carl.
Thank you, Mr. Schock.